Good evening, everyone, and welcome. My name is Rebekah Givan. I'm a member of the steering committee of the Labor Campaign for Single Payer, and I'm really thrilled to be moderating our panel tonight. We have a fantastic set of panelists with us tonight, and I'm excited for you all to hear from them. And we are going to think together about the fact that abortion is healthcare and healthcare is a workers' issue. And we can respond to the Dobbs ruling as we respond to so much that's going on with our coworkers in and through our unions. So we just want to spend time tonight talking about what we can all do at work with our union, how we talk to coworkers about abortion access, about the Dobbs ruling, about where we are now, what we're facing, whether the boss should control your access to abortion care. I think we know the answer to that. But what do you do when your employer controls that access? And then when you've thought about that, should the boss control your access to any other healthcare as well? I think that conversations about the despicable state of access to abortion and other reproductive care have to lead us to bigger conversations about the inherent flaws in our healthcare system and what we must do as workers and as a labor movement about that. That's all I want to say to start us off. I really want to turn us over to our exceptional panelists. I'll introduce them each in turn. They're each going to speak for a few minutes and highlight some of the things they're doing, some of the things they're working on with their coworkers and through their unions. And then I may ask them some questions, and then we'll open it up, and you can put questions in the Q&A that we'll then have from all of you. So I'm going to start with Sara Nelson. Sara is the International President of the Association of Flight Attendants. She's served as the International President since 2014, and she's been a union member since 1996, when she started as a flight attendant at United Airlines. And today she represents 50,000 of aviation's first responders at 17 airlines, soon to be 18. So thank you, Sara.
Thank you so much. And let me just say that I am I don't typically like to correct people, but I think you'll be very happy for me to correct you and say that it's actually 19 airlines. We have won some union elections, and so happy to report that. But I think what's really important is that we all recognize that the conversation that we're having here is urgent. And it is not just another priority on the ballot box. It's not just another issue that we're fighting for. It's fundamentally about whether or not women are equal under the law. And our country has been unwilling to say that to this point. But the rollback of abortion rights is not just a healthcare issue. It's not just a choice issue. It's fundamentally an issue of freedom and humanity and dignity. And as president of the Association of Flight Attendants, I know there's going to be a lot of discussion about what we can do in our unions in this moment, and what can we do to help maintain reproductive rights at the bargaining table. I just want to break that down for a minute and recognize that one of the things that the boss has done, the corporate elite has done to try to divide us, to try to take more and more from working people, I want to equate the right to abortion access, the right to bodily autonomy, as directly related to workers' rights, to the rights of people, and whether or not we're actually going to fulfill the promise that has never been reached in this nation. I stood there in Miss Muldoon's classroom in kindergarten every single morning with my hand over my heart. I thought that meant something. All of this felt very, very solemn, personal, and very like a mission. When I stood there, even as a 5-year-old, looking up at that flag and saying the Pledge of Allegiance every morning before we would start school, ending with the words, indivisible, with liberty and justice for all. And I want to just start by recognizing in our unions, we know the phrase, an injury to one is an injury to all. But I think that what we have to do is we have to take that very seriously into our hearts and actually own that and recognize that we have utterly failed to address that issue for women, for half of the population. If we were organizing, and I hope that we urgently are in every single workplace right now, we'd be looking at the different demographics, looking for the leaders, looking for the people who can bring the rest along. Well, Mother Jones said over 100 years ago, the capitalists say there is no need of labor organizing, except the fact that they themselves are continually organizing shows their real beliefs. And we have to understand that taking away a woman's right to access to healthcare, a woman's right to make her own decisions in her life, is taking half of the population off the table. It gives rape new meaning, the ability to control a woman her entire life. And it allows the boss to divide people along lines that weaken the working class, make it harder for people to organize because there's much more at stake. We know when people have a little bit, it's a little bit easier to organize because they have something to fight with. And today, in my union, 80% of the people that I represent, up to the point of that Dobbs decision, when they step off a plane, they step in this country, they step onto land where people have not been willing to recognize them as full and equal citizens under the law. And now, to go further, when they go to work, they take off in one state with one set of rights, land in another state with another set of rights, and they're in jeopardy every single day when they go to work that someone could deny them the right to basic healthcare, to save their lives, to make their own decisions, their own economic decisions. I think back to when I first started in this work and when I first started doing union work, and I had the honor of interviewing the #1 flight attendant at United Airlines. She had been, she flew for almost 60 years. I interviewed her sometime between 50 and 60 years. And I interviewed her because she had this extraordinary career, but she also had flown all over the world in the 50s, had talked with aircraft manufacturers, various governments around the world, civil aviation bodies, to get evacuation standards on the plane and equipment that was standardized across the world. That's still safety equipment that flight attendants check today. Extraordinary. First member of our safety committee. And so there was so much to interview her about, including working a craft mission into Korea and landing an enemy fire and commanding 18-year-olds because they landed in this ditch, and the flight attendants had to take control and help these 18-year-olds until they could actually get to safety. She had so many incredible stories to tell, an amazing life. But what she wanted to talk to me about was something that I had never experienced because I was born in 1973. And she wanted to tell me about what it was like when women had to access illegal abortions in order to keep their job as a flight attendant, when they had to access illegal abortions in order to get out of an abusive relationship. And she would have to help them do that. And she did not believe in abortion herself. But she understood her duty to represent these women and represent their own choices in their lives and also get them to safety. And so we can't just talk about this as another issue on the ballot. We have to understand that this is an attack on our very right to organize, on an attack on our ability to build power for the working class, to put a check on unchecked capitalism that is controlling our politics, sending us on the road to fascism right now. And it is fundamental that we fight with everything that we have for the rights of women to make their own decisions in their own lives. Because if we do not do that, every other fight that we have, every other existential threat that we have to take on right now, and we can only take on if we attack capital right where it exists and organize in our workplaces like never before, building up our unions by the tens of millions to have enough power to change the dynamics in this country and change the politics so that we can get solutions that are actually popular with the people and needed, take care of ourselves and our families, then we have to fight for the rights of women. And it's not just going to happen at a single bargaining table. We have to fight with an urgency right now that understands that it's all on the line, all of it, every bit of it. And so we can talk about the nuance of that, and there's plenty of experts on this call, my sisters, who are going to talk about what this means for individual women and what's at stake here and what we should be doing about it. But there is no more urgent call that we could be having right now than this discussion, because we have no rights. And I want to just be very clear. We have not been able to talk about this as a labor movement. We have not been able to say the word abortion. We have not been able to talk about the fact that this is a fundamental issue of freedom for women and the rights to organize. And the AFL-CIO did a poll that shows that even Union Republican women, 60%, believe that this is a priority on the ballot. This is an issue that we should be campaigning on. We should not be afraid to talk about this. Across the board, it is well into the 90% of union members, even in battleground states, of people who believe that this is a priority right now, that we need to be fighting on, we need to be talking about, and we need to be organizing around, we need to be voting on, we need to be protesting on, we need to be organizing on. So I'm here with you tonight in solidarity. We cannot be silent. We have to organize with the kind of urgency that our lives are on the line, because that's what's at stake here. I'm proud to be with the other sisters on this call, with all of my union siblings tonight. Thank you for inviting me to the call, and I look forward to the questions. Thank you, Rebekah.
Thank you so much, Sara. Thank you for always being so forceful and so committed and not afraid to say the things we need to say. For a few years, people have been hearing Sara say we need to say strike. We need to say that word out loud. She's right about that. We need to say the word abortion out loud too. I want to go to our next speaker, which is Dunn. Welcome, Dee. Dee has been a railroader and actual boots on the ground worker for 25 years, a track person, CDL driver, a welder, a foreman, and now a qualified safety liaison for most of the production units within the Amtrak IMCS department. Dee, we're delighted you could be with us today. Dee's also a member of the Women's Caucus of the Brotherhood of Maintenance Way Workers, part of the Teamsters, and we're delighted that you're with us today, Dee. So take it away.
Thank you so much. First and foremost, woo, you will put me behind Sara. She is so passionate. I love it. I have to thank the Labor Campaign for Single Pay for inviting us to participate in the town hall first and foremost. The members of Brotherhood of Maintenance-CWA employees are the women and the men who build and maintain America's railroad. We lay tracks, we build the bridges and buildings, we repair and replace overhead catenary systems, and hold responsibilities for maintenance, construction, and improvement of all rail infrastructures. We work 24/7 in all forms of extreme weather conditions, and we work throughout the entire pandemic due to the essential nature of our work. The women, the United Passenger Rail Federation Women's Caucus has gone on record as being 100% pro-choice, even though some of us have beliefs in our personal lives that will prevent us from getting an abortion under most circumstances. We believe that reproductive healthcare decisions, like all healthcare decisions, should be made between the patients and their doctors without interference from the government or any other outside force. About 4 years ago, our caucus ran a campaign within our union to get our national division to include paid parental leave as a bargaining demand in negotiation, both for our contracts with the freight railroad and our contract with Amtrak. We won the fight to include this demand in negotiation, but we was not successful at winning the benefit on the freight side. We are still bargaining with Amtrak, which leaves the possibility of winning this benefit for Amtrak workers. A demand for paid parental leave has never previously been raised in negotiations in our unions, and making it part of the process was itself a victory. Moreover, our campaign led to our national division president making paid parental leave a benefit for our national union staff. Paid parental leave is one of a number of reproductive justice priorities. The fight for the right to abortion access is part of a greater fight for reproductive and healthcare justice, which also includes the fight for single-payer healthcare, universal child care, a living wage, and affordable housing. All of these factors influence the ability of a working woman to raise a child or to decide not to go ahead with a pregnancy because the child cannot be adequately cared for. Without more support for working families, our reproductive options will always be limited, and women will not have the right to determine their own family planning in a safe and viable manner. The Supreme Court ruling had delivered a blow to healthcare as fundamental human rights. Abortion is healthcare, and access to abortion is a healthcare access issue. Since healthcare access is a union issue, it is incumbent upon unions to protect their members' rights to access family planning, services, and abortion care. The High Court's decisions through these vital healthcare issues and calls back to the workers and back to the bargaining table. Unions must look to strengthen existing collective bargaining agreements and health insurance coverage to protect their members' access to the reproductive health care they may need. Our health insurance through Amtrak covers the cost of abortions even before the Supreme Court's decision was issued. Recently, our plans was upgraded by the union management group that oversees our health insurance plan to include coverage from the cost of access to abortions for employees living in states with law prohibiting abortions. This coverage extends to the women employees, the wife of our male employees, and dependent children. While this type of benefit is good to address the immediate need, long-term, it has the same problem as relying on your employer for any of your health care. For example, you lose your job, you lose your health care. You go on strike, you lose your health care. Employers limit wage increases because of the healthcare costs. Additionally, who really want to go to a boss and request their benefits because they are planning to have an abortion? These decisions are highly personal, and in such a case, women should have their privacy protected. We live in a nation that has greatly failed poor and working class people in terms of providing any economic support for the cost of raising children. In this environment, forcing women to bear children against their will is an outrage. At a time when we should be expanding equity to poor and working class communities, the decision to overturn Roe increases economic disparity among these very groups. The burden of this ruling, excuse me, I truly apologize because I'm nervous and I'm losing my grip. I know this is gonna happen.
You're awesome, Dee. And we are hanging on every word and just wait.
Thank you. Our health insurance, covers abortion even before the Supreme Court. Yes, I am reading. This coverage extends women employees, wives of male employees, and dependent children. While this type of benefit is good to address the immediate need, long-term, it has the same problem as relying on our employees for health care. And again, for example, if we lose our job, we're gonna lose our health care. If we go on strike, we lose our health care. Employer limits wage increase because of healthcare costs. And like I said before, going to our managers to ask if we can have permission to get abortion, that's just not right. These decisions are highly personal, and in such a case, women should have their privacy protected. We live in a nation that is greatly failing poor and working class people in terms of providing any economic support for the cost of raising children. In this environment, forcing women to bear children against their will is an outrage. At a time when we should be expanding equity to poor and working class communities, the decision to overturn Roe increases economic disparity among these very groups. The burden of this ruling will fall most heavily on low-income families, community of color, and immigrants. These are people who are already barely making ends meet. Moreover, this is not just a matter of economic and health security, but it's also a matter of life and death. Research has shown that restricting access to abortion raises both maternal and infant mortality. When abortions are restricted or illegal, studies have concluded that women resort to all kinds of unsafe measures to end unwanted pregnancies. These unsafe practices accounted for approximately 13% of all maternal deaths, or nearly 50,000 annually. The court's reversal of Roe struck a major blow to the reproductive rights movement. The right-wing conservative courts is bent on systematically destroying any rights that put even a minuscule amount of power in the hands of poor and working class Americans. We have already seen attacks on unions by this court in a devastating Janus ruling, and that does not seem to be a hard-won right that will be excluded from their wrath. From the chipping away of our voting rights to the reversal on environmental protection, our very democracy is in a grave jeopardy. As unionized workers, it falls to us to organize within our workplace and within our union to build and to fight for reproductive and healthcare justice, and to stand up and stand together for all the rights that we have fought so hard for to gain. And in conclusion, our caucus, the United Passenger Rail Federation Women's Caucus, had presented our union leadership with a resolution responding to the Supreme Court decision for the overturning of Roe. It passed and was adopted on the federation level. Next, we will send it to our national division officers for voters. Thank you.
Dee, thank you. That's just fantastic and powerful, and bringing us from abortion access to reproductive justice to the whole social safety net we need to really support all of the reproductive work that is critical and is woefully under-supported in our society. So thank you. I'm going to move us to our next speaker. Maggie Carter is a Starbucks partner and organizer in Knoxville, Tennessee. She's a full-time student studying journalism and electronic media and a single mom to a 7-year-old boy. And thank you for being with us, Maggie.
Thank you so much for having me. It's an honor to be here with all these beautiful, strong women, my sisters in this movement today. So thank you all for having me. So I'm a baby in the labor movement, but I definitely am not a baby in this life. I have fortunately been able to, raise my son here in Tennessee, and obviously we've been through our struggles, but organizing in my workplace really has become the forefront to my life. And Starbucks has continuously waged war with partners for exercising their voice, from firing 7 of my friends in Memphis and over 120 of my comrades across this country, holding captive audience meetings with partners, using the benefits that we do have, dangling them over our head as if we will not have these if we continue to organize and use our voice, continuously retaliating against partners who appear to be pro-union. And to stoop to a new low, they even use access to abortion benefits as a tool in their union busting arsenal, saying that no new benefits can be given to unionized stores, and then later retracting that statement in the media. I go into work every single day with some of the strongest people that I've ever met, and the majority of those people are women. We go in and we service our community, and we do that with a smile, and we're glad to do so. We love our job. But the fact that they're able to use abortion access in a state in the South, primarily, that does not show up for its constituents, is really sickening. No matter what, bringing a child into this world should be a choice, rather than women being forced to birth a child that they cannot afford. This is one of the many reasons why not only workers, but women should continue to organize, to use our collective voice in states where leadership has failed to show up for us. Organizing gives us a voice in our workplace and a true voice in society by helping shape the working conditions in your work or the conditions in your state. We must continue to organize, as Sara so eloquently said. We must organize collective action and show the Supreme Court that women indeed are the supermajority. Women make this world go round, and I'm sick of men in politics making decisions over my body. We are mad as hell, and we're not going to sit down and be quiet. We're going to fight, and I'm very happy to be with my incredible sisters who are heading these fights across the entire nation. Solidarity to everybody on this call, and thank you so much for having me. I know Starbucks Workers United we are going to continue fighting for access to healthcare within our workplace, but not just within our workplace, also beyond it. And I can't wait to see, hopefully, some of you at those actions as we continue. But thank you so much.
Thank you so much, Maggie. And and Starbucks workers who are still fighting for their first union contracts are facing the situation where even when the employer claims that they will cover access to abortion and other reproductive care, the employer also controls your hours and can cut your hours and take away your access to care at all. And this is what happens when healthcare is in the hands of our bosses and we don't have strong protections in place. I'm going to bring us to our next speaker, Martha Valadez. Martha was laid off as an apprentice electrician in Texas early in the COVID-19 pandemic. Thankfully, for all of us, they found their way back to community organizing as a national organizer with Jobs with Justice, where they currently support campaigns in the construction sector and other efforts for expanded bargaining. After attending the 2022 Labor Notes Conference and joining a number of News Guild trainings, Martha was re-energized to become an active member of the News Guild Abortion Access and Healthcare Autonomy Working Group and become a steward for their unit in the nonprofit sector. So thank you, Martha.
Hey folks, hola, saluditos a todos. I'm really grateful to be here with you all. Thank you for inviting me. I also am very green. I've been in the social justice movement for a long time, and I've done labor organizing as a contracted organizer. But being with my union since June, in the height of the pandemic, June 2020, and joining up when the Supreme Court announcement came out, and meeting folks from my union, and stepping into my power, being here based in Texas and sitting at my computer by myself here in the pandemic, that's still going on. It was just amazing to know that there was a space. And in our first meeting going into it, talking about, abortion access and should we change our name to be more inclusive around gender affirming care and bodily autonomy. That was just radical to me and amazing that I was part of a union that was creating spaces for us to talk about these issues, and figure out strategies and tactics and create resources for our membership to be able to activate their own locals and distribute knowledge and share our power. And so back in July, and this working group, I'm humbled to be sharing, but this working group really had been moving and developing this toolkit and sample contract language to share out for some time before even the Supreme Court announcement. And so they were preparing, and it was really, really humbling to just be in space and take and receive and redistribute. And so, so we moved into action with my unit. I'm part of the News Guild Local 32035, and I'm part of the unit for a nonprofit. And so our small unit, I just moved rapidly. We have a lot of things going on. I was able to move and do research and figure out how, what the heck is health insurance, talk to our broker who's super progressive, our insurance broker, to get details about how this could even happen. Perfect timing. He was looking at vendors to figure out also who was trying to figure out, is there a vendor who would be willing to provide this as a program around abortion access and gender affirming care? The ability to do both of those things to create a policy, an interim policy, right? Because our contract isn't up for negotiation until the end of next year. And so being able to respond rapidly and put together a policy that was already, adaptable and malleable for the interim was just really amazing. And we were able to move quickly, got a group of people together to edit, offer feedback, and consult within our unit. We took the draft back to Hill and Danielle from our, the News Guild, from our national reps, to be able, from the working group, to be able to really revise and edit and shape it. And I didn't know nothing about insurance, but I learned a whole lot about insurance policy and language. I just knew that my body was being limited here in Texas to be able to, even think to even, get gender affirming care or figure out what would I do if I needed to get an abortion there, the cost and everything. So this was an amazing policy, covers up to, what the taxable amount, which is up to $5,000 for travel expenses, for the care, for the service, even for assistance for a loved one to come and accompany you. And we, presented this in early August. My goal was to get this done by September. We had some other things come up internally that really caused the delay. But actually this past Monday, for the first time, I went into a labor management and union meeting to be able to present, deliberate, discuss, and really flesh out the details on the language to just get us to a point in saying like, and also just express myself and bring union members. It was the first time I came, and I think for the first time where union members came with us to a meeting with management to open up that space to say like, you know, to be part of that discussion. And so it was a few of us, right? Like we also have a big event going on this week that we had yesterday in DC, but it was just amazing to be able to bring folks together and to hear management say, like, this is important. We are aligned in our values. We're a progressive organization. We should be, right? And they understand the timeliness of this. And so we're hoping by, you know, like there weren't any major red flags. We're hoping like by the next few days or the next week, we should be getting a response to make this formalized policy accessible. And it, you know, this is important for us because it will be the first within the nonprofit sector that we know of. And it will be something that we could share and, you know, like continue moving and energizing other folks to do the same. And so, yeah, the policy is rad. It has around privacy, which is what a lot of other folks have brought up, around anti-discrimination, and just our overall like alignment and values around why this is an important issue around healthcare. So that's pretty much it for me. Thank you for allowing me to be in the space with y'all.
Thank you so much, Martha. And I think what's fantastic about what Martha has been doing with their coworkers is they're actually bargaining and getting something that's going to be enforceable and that's going to help their coworkers immediately. Martha is one of our panelists coming to us from an abortion ban state where this is a problem now. This isn't about future insurance and what ifs. This is what they're all facing now. I'm going to bring us to our last panelist. Becky Nelson is a registered nurse working in Minnesota at an urban Minneapolis hospital and currently chair of the Minnesota Nurses Association Governmental Affairs Commission, where she works on state level legislative policy. She has decades of healthcare experience, including 21 years as an RN and 10 years of union leadership experience. So thank you, Becky.
Thank you, everyone. This is really a tough act to follow. I'm really honored to be here. I'm honored to be asked to be on this panel. Bear with me. I'm not a professional speaker. I'm a nurse, actual practicing clinician. So again, my name's Becky Nelson. I work in Minnesota at a large urban hospital. Minnesota Nurses Association is about 20,000 members total throughout Minnesota and the Dakotas and Wisconsin. As she said, I'm elected leader with the MNA as the chair of the Commission on Governmental Affairs. As a clinician, my practice specialty area is peri anesthesia. So at work, I routinely do provide care for reproductive emergencies, other reproductive health issues, such as women that are having complicated miscarriages with hemorrhaging, women that need services for an ectopic pregnancy, women that are terminating their pregnancy related to birth defects in their first and second trimester. So this is really an issue that I work with almost every day and it's really close to me. I thought talking today about my personal nursing experience might not be exactly what you guys all want to hear. I don't think this is quite the audience for that, but let's just suffice it to say that my own personal practice would be made much more difficult if reproductive health care access in Minnesota was restricted or banned entirely. We would see a lot more emergencies. You know, we are used as nurses to dealing with emergencies, but do not think for 1 minute that this isn't hard on us personally. You know, almost every time I have to care for a woman that has a reproductive health issue that comes in the middle of the night at 2 a.m., I end up crying in the elevator. It's a real thing. It's a real workplace issue for us. And this is one reason why I feel so strongly about this. So what I want to talk today about really is what the Governmental Affairs Commission did on this issue. So we recently passed, under my leadership, I guess, a resolution, and we titled it Organizational Support for Women's Rights to Reproductive Health justice. We had our annual convention in early October, just a few weeks ago, and that's what happened. I do have the copy of the resolution if anybody wants it on the screen, or I believe the moderators here can email it to you if you want a personal copy. So I wrote the resolution. It passed through the Governmental Affairs Commission and got an endorsement from the board of directors. Those votes passed by a large margin. The convention in October, although we do have some more conservative measures, it passed by about an 80% margin. And why we did this, the M&A previously did not have a position on reproductive justice. And my understanding is that former leaders didn't want to take it up because they were afraid to do so and they thought that it was divisive. So, you know, although there were some historical barriers to getting this work done, it ultimately proved, you know, to be a choice, proved to be a popular position, and it really passed without a lot of difficulty. So what our resolution allows the Nurses Association to do now is to, number one, work in coalition with organizations that support issues around reproductive justice in women's healthcare, like the Planned Parenthood, for example, or other local organizations. So number two, it enables our lobbyists to support state legislation that would codify women's healthcare rights. So this is a big deal, you know, after the breakdown of Roe versus Wade for everyone in the country. And in Minnesota, we're concerned about it as well. And number three, it prohibits the M&A from endorsing anti-choice candidates for elected office in the state of Minnesota. We do actually endorse on the occasion Republicans that support our issues. Not that you know, our issues are basically around nursing, but this would prohibit us from giving that endorsement to a politician that doesn't support reproductive choice. And then number four, it does allow the M&A organizing staff to consider taking a look at unionizing facilities that provide full access to women's health care. So the Minnesota Nurses Association mostly has nurse members. We do also have some other types of members, techs, pharmacists. You know, we could potentially consider organizing facilities like Planned Parenthood that provide abortion services. So I thought today I would kind of talk about the nuts and bolts of getting the resolution passed and the barriers that were put in front of us. I'm hoping that I know this is fairly specific. I hope I'm talking to a lot of union leaders that are interested in maybe doing an action themselves. So this started with a commissioner. This started with a commissioner request to address the topic, given the situation we're in with Roe versus Wade. Our rationale for doing this specific to our union, to the nurses that came up, is that number one, we're a majority female profession. We are really about 90% female. Many of us are in our childbearing years, and this affects us personally. Our reproductive capacity and issues around that comes up often in the workplace. I've had coworkers discriminated against for breastfeeding in the workplace. We are still working in many, many hospitals without paid parental leave, and there are economic concerns around child rearing and childbearing. Job retention, promotions, these are all related to women's reproductive health for women in their childbearing years. And of course, we as healthcare workers, we should be supporting a full and unrestricted range of healthcare services for any body system. That includes women's reproductive health. And we felt that at this time, we needed to go on record with this. So as far as the state of Minnesota goes, we are set to become an island with regards to abortion care. It's currently unrestricted here, but that is not the case. Access is potentially jeopardized in our neighboring states of Wisconsin and the Dakotas. So preservation of services for our specific community and the greater community was a concern for us. And nurses are really the workers that are on the front line of bearing witness to so many issues around reproductive health care, whether or not their reproductive capacity or health care goes the way it's supposed to or not. As I said before, my personal practice would change dramatically if abortion access was restricted in my seat. So I'll just go through the steps we went through to get this resolution passed briefly. So our process of getting a resolution passed takes about 6 months. As I said before, this was brought forward by another commissioner. We made the decision, to vote this through as a commission. It went to another committee. There's a lot of bureaucracy in unions to make sure it didn't violate any bylaws. And after that, it went to the board of directors. They endorsed it. And finally, we made the last step at the convention a couple of weeks ago, where it was voted through easily. I will not say that I didn't get any pushback, because I did. We do have a contingent of more conservative folks that just simply don't agree with choice because of politics or because of religion. I did get quite a few, I'm not going to say quite a few, I got a few emails and phone calls that wanted me to withdraw the resolution completely. So we would continue to not have a position on this at the Minnesota Nurses Association. I got added to a few really conservative email chains. I think they were trying to change my mind, didn't work. I did get a little bit personally attacked for this. And I just want people to realize that these are super popular policies. People don't, especially women, don't want their choice taken away. Even Republican women, even conservative women, even religious women. So ultimately, this did pass without a lot of changes on the convention floor. There are a couple amendments as well that were defeated. And so this was the initial resolution that I presented went through without any amendments to it. Let's see, what else do I want to say to you? Yep. So yeah, that is about all I wanted to say. I just want to say, I'm super proud that the M&A resolution titled Organizational Support for Women's Reproductive Health is policy now at the M&A. Again, it passed with a little more than 80% vote. And I just want to encourage any member leaders that are on the call that may want to engage their union on this, that it isn't as scary as you think it is. There may be some pushback from your more conservative religious contingent of members, but ultimately what you've been hearing in the media regarding pro-choice positions being popular with a wide swath of the general population has really proven to be true in my instance. So our members are all over the map politically, and we did get it done. So thank you guys for your time.
Thank you so much, Becky. If folks have questions, you can put them in the Q&A, and I think we'll also go ahead and open up the chat, and we will share some of these resolutions that folks have passed in their local or their federal state feds. Some of the things that we hope that everybody here will consider doing, one is passing a resolution in your local or in your larger federation. Another is bargaining stronger protections and looking at the language you have if you have a contract and making sure it's strong enough, and if it's not, going back and trying to strengthen it. The other is political action. Some of us can be easily turned off by politics, but it does make a difference. It does matter, and we've seen that with the Dobbs ruling perhaps more clearly than many other things in recent times. And so making sure you take political action and support those candidates that support choice and support abortion access and reproductive justice. And the other thing that hasn't been mentioned yet is look at your labor management funds, your Taft-Hartley funds. If your healthcare comes from a joint labor management fund, you have labor appointed trustees, and they have the ability to make sure that the full range of reproductive care, of gender affirming care, is provided in that context as well. I do encourage you to put some questions in the chat. I wanted to give an example also that came to mind when Sara was speaking about talking to some folks that have some pretty resonant memories from the time before Roe versus Wade, and talking to my own mother about the situation, and I think this speaks to what's on our minds tonight, where a friend of hers was hemorrhaging after receiving an illegal abortion prior to Roe v. Wade. This woman almost died because she didn't want to go to the hospital to get help. She needed a blood transfusion, but she couldn't pay for a blood transfusion because her parents would find out if she put it on her insurance. So I found out after the Dobbs ruling came out, my parents were able to donate blood, and that blood gave you credit for a transfusion that you wouldn't be billed for. And the idea that that is our healthcare system, where you have to literally give blood to pay for life-saving care because abortion access is not available. I mean, to me, that sums up everything that's wrong with our system, that lack of access to abortion care and the financialization of everything we need to do, where we should be prioritizing care for each other as a society rather than trading our blood to save someone's life. So we'll open up the chat if folks want to introduce themselves to each other, and we will share some of the links to resolutions and other resources that we have. But I want to ask a question that came up in the chat from actually from Katie Murphy. Thank you, Union President. What can folks do? And I'll go first to those in abortion ban states. Maggie and Martha, if you want to weigh in, and Sara has many members in those states too, to say what can folks do in states where reproductive health is safe or safer to support the immediate need. So I don't know who wants to jump in first on that. I'll open it up. I know that everybody here is working nationally, not just in their own location. So Maggie, do you want to jump in on that?
Yeah, I mean, I think definitely like helping, you know, with resources, like helping get resources to people in those states, and resources, even just places where people can go, places where they can look to for support from these states where there is none. I think building those networks to very critical states is so important, and that could be a massive help as well. But I'd love to hear what others think as well.
Yeah, anyone can get in on that, but Martha or Sara, did you want to say anything specific? Go ahead, Martha.
Yeah, I dropped my local abortion access fund in the chat, so donating is always great. I think, yeah, making connections with folks, right? Like, it's a real privilege that we have insurance broker that helped us to be able to, for me, who has an organization based in DC, to be able to, you know, access a service outside of my state. But for folks and unions here in the state, it will be a lot harder. It will be a lot more complicated for insurance-based services here in the state. And so I think it's really, you know, looking to build solidarity, build connections, build resources for, you know, folks who may not be represented, may not be in a union, right? Or may not have a union, right, in a right to work state that doesn't have access to an insurance benefit, and isn't there yet in terms of figuring out a strategy or a tactic or a breakthrough to really find that. So I think it's right. It's like finding solutions for folks to be able to get to services and needs is what I would say is the best bet, is like connecting with folks out of those states, and particularly organized, you know, folks who have experience doing this supportive care is important.
Thank you, Martha. Sara.
So Rebekah, we have all of our airlines provide travel paid for to states where our members can get full access to healthcare. And so that's important. It's important to share that. But I want to just, and I want to be very clear. I thank you so much for saying that we have to take care of the people who need help right now. There are people who are being denied help right now. But we also have to be definitive about the fact that this has to be overturned immediately. That is, it is urgent that we overturn this immediately, that we pass a law that provides women with full and equal rights under our laws, period. And so when the Dobbs decision came out, I wrote to each of the airline CEOs and asked them to speak out. And only 2 put out publicly their policy on travel. Okay, now, many of them wrote to me and said, we're going to communicate with the employees and tell them this. They were all afraid to say something. I think it's really important that we recognize that women are the fixers. Women have cleaned up the messes. We've made things work. We're used to being marginalized. We're used to being cast aside. We're used to not being asked what we think. We're used to people thinking that we should get less, or that we should just make everyone comfortable. It's really time for us to make people uncomfortable. Every single one of those CEOs is a man. Every single one of them has children. And maybe they only have children because the people that they had children with had access to full healthcare. And so who knows what that history is, but as Becky said here very eloquently, this, and I think Dee mentioned this as well, when people have full access to healthcare, you have, fewer infant mortality, you have fewer deaths of women in childbirth, and that affects women in socioeconomic brackets completely differently. And of course, women are still going to get abortions. Women who have money and have access will be able to get those abortions. Other women will die. And so we need to be really clear with the companies. One of the things that we haven't talked about here is putting real pressure on these corporations that say that they want to sell airplane tickets to women, that say that they want to sell coffee to women, that say that they want to get goods and services and open up the supply chain jobs to women too. All of this is bullshit. They all have their D&I committees. We need to be calling on each one of these corporations to speak out right now and say how this is going to harm their business, say that this country has to reverse this. Otherwise, the people that they are calling their customers and their bread and butter, their business, will not be able to access that, will not be able to be consumers, will not be able to be workers, will not be able to do all of these things. We have to make people really, really, really uncomfortable, because as Becky said, we're trained for emergencies. But as I know, as a safety professional and the work that we do in safety, we try really, really, really hard to make sure that no emergencies are created, that we're not adding to the emergencies that are happening. So these corporations right now with their silence are adding to the emergencies, adding to the hell that Becky and her coworkers are going through. And we have to understand as the working class that if we're not on top of this, we are undermining our ability to hold capital accountable, to change everything else that we want to change. And I'm starting to repeat myself, but I really think that this is one piece that is missing. Corporations have spoken out on other social issues, and we cannot be afraid as women to demand that they speak out on this too.
Thank you, Sara. That's absolutely right. We just have a few minutes left. I would like to ask the panelists to weigh in about how to talk with your coworkers who may not be as on board. Becky gave some great examples of coworkers who think it's too political, or it's not a workplace issue, or we should focus on bread and butter. And I'm sure everybody here, I'm going to give Dee the opportunity to get in first, but I'm sure everybody has been having these conversations. So how do you talk with your coworkers who may not be on board?
Well, pretty much what we do as the Women's Caucus, we hit all our lodges. We have working with a lot of men is crazy. And we use the tactic, what about your family? What about your daughters? What about your wives? So when we go to the lodges, we speak on all issues. And the beautiful thing about it, they listen to us. And the support we have with the union. And that's what's the crazy thing is, compared to listening to everybody else working in environments with mostly females, and then we're working in an environment with mostly men, and we're getting the support that is needed. So talking is not only in the workplace, but outside the workplace. And like now, we have these elections going on. We want to take it to the street. We're going to do whatever we need to keep it going, to let it be heard. We're not going backwards. We're going to keep pushing forwards for our rights, for for all healthcare rights, period. Thank you.
Thank you, Dee. I don't know what you're going to run for next, Dee, but you have my vote. Anybody else want to weigh in? Becky said a little already, but maybe Maggie has some thoughts on coworkers who are in different places with this issue and how much you're talking about it when you tell them it's a workers issue.
Yeah, for sure. I mean, this is definitely a workers issue, especially being at Starbucks. I think there's three mothers that I work with, and two of them are single mothers. So we obviously identify with this issue, but fortunately, at Starbucks, we do have a little bit more progressive of a workforce. So, I haven't run into this issue, but I do think that if I did run into it, I would take a very similar approach to Dee and say, what about if it was your daughter or your sister or your cousin who is about to graduate college, or any of these scenarios that happen to women every single day. That's got to bring some empathy for someone. And also, not only that, we have record inflation right now. We don't have a system that supports working mothers in a way to where we can afford to take the time off work. Me, for example, just using a personal situation, I worked up until 2 days before I gave birth to my son, 7 years ago. And that put my body through a lot of things that, it shouldn't have had to go through, while also giving life to a newborn. So, these issues are experiences that I would share in these conversations, as well as, relating personally to each other and just saying that this is a healthcare issue. It's not a religious issue. It is a healthcare issue, and women deserve access to healthcare.
I think, yeah, that's absolutely right. I want to give everybody a chance to say any closing thoughts or anything that you didn't get to, but I do want to highlight in the chat, Martha's union, the News Guild, has put out some phenomenal resources, and we shared in the chat some of the online, there's a Google Doc that links amazing resources, including contract language. Someone had asked in the Q&A about what if your employer doesn't cover abortion access, and there's different sample contract language you can demand and work towards to try to help that. For instance, if there are no providers in your area, where either because of local laws or because it's dominated by Catholic healthcare systems, so there are sample contract language around that you can take a look at. But I want to give everybody a brief chance for any sort of final thoughts or responses to what you've heard. I'll come to you first, Becky.
I just want to let folks know that if they do want to discuss this offline, need help going forward, want to talk about resolution language, I'm willing and able to help. This is something that I really feel passionate about, and this is something that every union, I think, in the United States needs to tackle, because this is not going away. I will drop my my social media and my email in the chat, so if you want to follow up with me later, you can.
Thank you so much, Becky. Martha?
Yeah, just to say thank you for having us. Representing someone who you would, in the trades we'd call rank and file. Like, I'm just a member. I just recently became a steward. anybody can get involved. Anybody can find someone else to talk to about the issue and strategize. And it's everyone should have a space to organize, and that's why we need more unions, and we need more representation. We need folks protected, right? Because this one policy we won, right? There's just still so many people that need to be covered, that need to be protected, that deserve access to, you know, healthcare autonomy and their own decisions on, you know, just their body, right? And I wrote in the chat that I think it's important for us to think about language when we're talking about abortion access, and that gender affirming care is really important, and gender affirming language is also just as important. So that's it. Thank you for having me.
Thank you so much, Martha. Maggie?
Yeah, I would love to say thank you so much for having me. It's an honor to be on a panel with so many incredibly strong individuals fighting for what's right in this country. My best advice to everyone on this call is to organize, whether that's your workplace, whether it's political action, collective action in any capacity. We need as much of it as we can get right now. Organizing has given my life a purpose that I've been searching for a long time. And it's really a beautiful process to take part in with your coworkers, to really show up for each other in ways that you could not do so before. And also, you know, it's really time for us to get out in the streets and be loud as hell, be mad as hell, and really cause some ruckus around this issue, because we're not going back. And I'll leave it off with that.
Thank you, Maggie. Dee?
Like I think I left a tweet at the beginning when you first asked us to put a little tweet. Family issues are union issues. And again, right now we have an election going on. We need to hit these streets. We need to be loud. Like Maggie said, we need to let them know we will not be going backwards. We're going to continue to push forward. We're going to continue to get together. Our caucus, we also have our resolution in the link. Check it out. Again, we're going to keep pushing forward on all this. We're not going to stop until everybody's equal, until everybody get health care. One nation, as they say, under who? Thank you again for inviting us.
Thank you, Dee. And Sara?
Thank you so much, Rebekah, and thanks to everybody. I think everyone said this at one point, but Dee said it very directly. When we spoke up in our union meetings, our union siblings listened. And so we need to be inclusive. We need to speak up. We need to recognize that the labor movement is not just the people who are already in unions, but all the people that we need to reach out to and get unions into their hands. And so this issue is about speaking up for all the people who don't yet have a way to speak up for themselves too, because that's how we're going to build power to get what we really need. And thank you so much to Single Payer for linking this right back to Medicare for all, healthcare as a human right. Because if we have that, then we can't be parsing this out and depending upon employers and talking about this as another distraction from improving our lives and getting to a place where we can get back to celebrating 8 hours of work, 8 hours of rest, and 8 hours for what we will, for everyone, from every background, every gender. And that's really ultimately what this is about. You heard a lot of anger in my voice from the beginning. Let me be very clear, that's not going away anytime soon. It's going to continue to fuel me. I feel joy right now for being with all of you talking about this. I feel joy from my union siblings and our commitment together to fight forward. But fundamentally, listen to what Dee said. Speak up. People will listen. We cannot be afraid and be silent on this. We have to speak up and bring other people along with us.
Thank you so much, Sara. I want to thank all our panelists. You were fantastic. I feel energized. I feel inspired, and I'm ready to go out and keep fighting. We need to take healthcare off the bargaining table, but while we're doing that, we need to put abortion right on the bargaining table. So thank you all. Everybody have a great night. We will follow up with resources and access to the recording. I want to thank everybody for taking the time tonight, and I really want to thank our panelists. You all were fantastic.
Thank you, Rebekah. Thank you, everyone. Solidarity forever.
Thank you all.
Solidarity forever. Bye, everybody.
Thank you,
Thank you
Maggie.
much.
Thank you, Dee, Becky, Martha.